It is Breast Cancer Awareness Month, and we are making sure that you know everything that there is to know about breast cancer. All the questions that you have, we asked a bunch of people on our social media platforms, you know, what questions would you like to have an oncologist, a person who is a specialist in the field of medicine for cancer, and get them to demystify these things. Some of these myths and misconceptions, you know, what are the stages? Is it painful? If I hug someone who has cancer, will I get it? I am joined today by the amazing Dr. Wanda. It's so lovely to meet you. Tell us a bit about yourself as we start this episode.
So thank you very much. My name is Dr. Dulcie Wanda. I'm a clinical and radiation oncologist. That means it's a doctor who's able to treat cancer using chemotherapy and radiotherapy. Pleased to be here because we can create awareness.
Yeah.
I believe most of the patients I see are stage 3 and 4, and I feel sometimes that is because we don't give them information. There's no one to ask, and by the time they get on oncology, sometimes it's very late.
Yeah.
So I'm happy to be here so that we can deal with those myths, misconceptions, people can know the truth, and hopefully help someone get perhaps to know whether they don't have cancer, and even if they do, we catch it early.
So one of the common questions that we got are, what are the symptoms of breast cancer?
To start off, cancer in the beginning is not painful. So what you would notice perhaps would be subtle changes within your breast. For example, you notice one breast has become larger than the other one, feeling of heaviness within the breast. You may notice skin changes where the skin looks like a tangerine, has spots on it. We call that poudre orange. So it has spots like a tangerine, and that could be a sign that there is a problem. Ideally, nipples most of the time face out, but when there is a problem like breast cancer, you'll find one of the nipple is retracted, it's pulled into the breast. And when you press the nipple, sometimes you might notice a discharge coming out, either fluid or blood that would come out from the breast, from the nipple. The other thing could be a mass. You may be able to see a mass within the breast that is a hard pebble-like, stone-like. Some people you could see it, others you would touch and feel like there's a pebble within your breast. Sometimes the breasts don't have symptoms, but the axilla has symptoms below your armpit. You might find there's a swelling there. Those are the nodes. Sometimes you have nothing on your breast, but the axilla is the first place you notice a mass. Yes.
So these symptoms may occur at different stages. So someone was also asking, like, what are the stages of cancer?
We have about 4 stages of breast cancer. We have stage 1, stage 2, stage 3, stage 4. What I say, it's not like from 1, from 2, from 3, from 4, that now when you reach the 4th stage, that's the end. We have many patients who have gotten to stage 4 but have had a very good overall survival based on maybe the tumor type that they have. It's hormone receptor sensitive. They had few metastatic lesions that have been addressed, and that has gone a long way to helping the patients do well. So knowing a person is stage 4 is not always equal to death. And I think most people, when they hear, they ask you, Daktari, ni stage gani? Pretty much what's going through their mind is, how long do I have, or how long does my loved one have to live? So I think with the medications that have been developed, the use of targeted therapy, the use of immunotherapy, the use of hormone modulation, it has been able to increase the overall survival, and stage 4 patients are able to live and have a life. For breast cancer, unfortunately, you can have a 1 centimeter lesion but have it at stage 4.
Wow. Okay.
So it is not the size or the presence of the symptoms or the duration it has been, and that is why it's important to go for screening, because sometimes if you don't go for screening, you will never know, but it could already be metastasizing and going to other parts of your body. So the most important thing is to have a schedule every month after your menses to do a self-breast exam, and at least yearly to go for a clinical breast exam. For those who are below the age of 40, it's important to go for a clinical breast exam. If we notice findings that are not normal, we'll send you for an ultrasound. At least that is more detailed viewing of the breast. Then if you're above the age of 40, we would send you for a mammogram. So a mammogram is an x-ray of the breast. So your breast is placed and compressed between 2 paddles, and an x-ray is taken. Some of the very early signs of breast cancer might be just a calcification, just a line, or something that looks like a spicule within the breast that you can't feel.
Is it communicable? Like someone said, I'm just going to read this. Someone said, some people say that cancer can be transmitted through touch, like hugging or shaking hands. So if I interact with someone who's had who has breast cancer and I come into contact with them, is that communicable?
Breast cancer is not communicable. It is not a cancer that you can get because you hugged someone or interacted with them or had sex with them. That's not something, it's not going to be passed from person to person.
Yeah.
Remember, for the breast cancer, there's a mutation, a change in one of the cells. So the DNA of the cell has become not as organized. Ideally, a cell should be able to be formed, grow, divide, and eventually die off.
Yeah.
But that channel of the cell growing, dividing, and dying off, that sequence is disrupted. So you have a group of cells that are just growing and not dying off, and that's what forms the mass.
Yeah.
So that is not something I can pass on to a loved one or a friend.
Yeah.
And I think that's an important myth to actually dispel, because most of our cancer patients say the cancer journey is very lonely. They feel that they're abandoned by friends, by relatives, and I think that's one of the myths that could be making people stay away, because they think they would get cancer just by interacting with them. So it is not communicable.
Actually, there is no cure once you get cancer.
Well, that's a myth, and I think where it stems from is where we were in the past. If you look about 20 years ago, we didn't have a lot of the drugs we have today to treat cancer. We didn't have a lot of the places to treat cancer. In essence, like we didn't have oncology centers distributed. Like in this country, perhaps they were only in Nairobi and Eldoret. So that meant if I was in Mombasa or Lodwar or Garissa, there was nowhere to go if I didn't have funds to go to Nairobi, if I didn't have funds to travel, or there was no insurance. Maybe 30 years ago, there was no NHIF to assist or SHA at that point in time. And that meant that people would really struggle to raise funds for treatment or go where treatment is. And many people felt like anybody who got cancer died. Right now, we have so many oncology centers. We have decentralized care. The presence of insurance has also helped because we have a community that is educated. They understand you need to have insurance, and that has made them learn to know if I have insurance, it's beneficial. Previously, we were only getting insurance when we fall sick. So I get a fracture, then I go pay for insurance. But I think over time, people have seen it's important to have the card before even disease comes. And that has gone a long way in assisting, making sure patients can be able to access care. So I think the fact that there was no cure or no ability to treat in the past has stuck with people.
Is India better for treatment than Kenya?
So in India, one of the things they have done very well, one, is to have medical tourism advertised.
Oh, okay.
So they are able to come here and tell us this is what we can do, these are the testimonies. And then previously, there are certain services that were not available in Kenya. For example, when we treat you for certain cancers, we need to do a scan called a PET scan. That shows us the whole body, whether there is any disease at the microscopic level. So that scan was not there. So at that point, if we needed that scan, we would send patients to India, wherever they were comfortable with. If they wanted to go to South Africa, we would do that. And I think over time, that need has gotten less and less. Because in the country, currently we have more than 5 PET scans. Yes, all of them are concentrated within Nairobi pretty much, but at least there is access within the country.
That's true, it's within.
There are certain drugs we didn't have, like the targeted therapy, we didn't have them in the past. And if a patient needed that treatment, the only way they could get it is either travel or those drugs to be sent. But that is not where we are right now.
There's this thing where everyone feels like if I stand too close to the microwave, then I'll get cancer. So tell me, what's the relation, if there is even one, between a microwave and cancer?
Radiation is a risk factor to getting cancer. However, there are different types of radiation based on the wavelength, and the microwave is low on that risk of cancer. However, what you use to put in the microwave. There are certain plastics that when put in the microwave disintegrate, not physically something you can see, but some of its chemicals can get into food. That is why we are recommended to use the BPA-free containers or the ceramic containers, because they don't disintegrate, and there's melamine, glass, and that would work well compared to plastic. And the type of plastic matters. Whether it's really specific only for breast cancer, no, but it is good to use the correct containment or containers when putting food in the microwave. So that's what I would say. But standing close to a microwave has not been shown to cause cancer.
Men are curious about this. Does sucking my partner's breast reduce the risk of her getting infected with breast cancer?
So breast cancer has a huge hormonal component, such that having many ovulation cycles, meaning your hormones, the cycles are going round and round, is a risk factor. So when you breastfeed, you reduce the number of cycles you have, because pregnancy helps, and then after that there's what you're doing in terms of breastfeeding, and that really helps. But whether after that, now there's no breast milk being produced, when your spouse sucks on your breast, it is not sufficient enough to cause you to have hormonal suppression. However, the advantage of us being comfortable with our partners in our breast is that there are cases where the man is the first one to notice a lump. So because he knows how the consistency of the breast feel, the husband has been the wife for some time, then he knows and he's like, I feel something different. And that could be the cue to go to get screened. So even when we are teaching how to examine the breast, it's important for the men also to listen, not just for their wives and girlfriends, but also for themselves, because breast cancer happens in men.
Oh, okay.
We need to start with men have breasts.
Yes, they do.
Okay, so men have breasts. Yes, and they can get breast cancer. And at least for us, there's space in which the tumor can grow in. But for men, they have less dense tissue. Meaning if there is cancer, it's very easy for it to go to the ribs and the lung. Meaning it becomes more aggressive. For us, there is room for the tumor to grow within the fatty tissue before it attacks the ribs and the breast. So men too need to learn to look at their breasts to see, is one larger than the other? Do we have the skin changes that look like spots or pores like a tangerine? Is there an ulcer? And remember, when cancer begins, it's not painful. So there'll be no pain. You'll see a change that is painless. So it's really important to go to hospital whenever you notice that change, so that we can take a piece of that area, which is a biopsy, take it to the lab and confirm, does it have cancer cells? And if it has cancer cells, then that's our cue to intervene.
Now you know. Do with that information what you will. Lifestyle. So someone also mentioned this, that they studied cancer as a lifestyle disease. How true is that?
So whether I would say cancer is a lifestyle disease purely, I might not agree. I believe cancer is multifactorial, because we have people who are very fit athletes who have gotten breast cancer. That would not mean their lifestyle is bad. It's just to mean, why I say multifactorial, there are many things that can cause one to get breast cancer. Purely picking out lifestyle as the only thing might not be right. However, that's not to say that we can't prevent or do something ourselves. There are things that we can't change. For example, breast cancer is more common in women than men. So even if we would go through a sex change, the innate female characteristic would still place me at risk compared to a man. Those are things we can't change. The fact that we are female, the fact that we have breasts, the fact that we possibly have genes or our family members have had cancer, but there are things we can do. We can exercise, we can avoid being obese, we can make sure we're not smoking, alcohol use is on a low, we can make sure we're not taking contraceptive methods that are not approved. For example, there are people in this country who are taking a certain pill that is sold in the market, like in the literal market.
Like soko. Like kununua mboga,
niongeze ile pile. So there are certain people who are taking a pill, one pill, and taking it for a month, and that is keeping them pregnancy off pay, but it is not sanctioned by the Kenya Poisons and Pharmacy Board. Why? It's a very high concentration of hormone. The other thing young people are doing, we have sex on the regular, but we take emergency pill. As the name suggests, emergency pill is for an emergency. An emergency. Meeting your boyfriend is not an emergency. It was planned, it was scheduled. So repeated use of an emergency pill is also putting your hormone in balance. And if you'll notice, if you take your pill, then you'll find your menses are off the charts. So you're also putting your hormonal imbalance at that point. What effects will it have? Has it been researched as a regular family planning method? No. Why it was put in place, it's in cases you were raped, you don't want to conceive, you wouldn't want to have a child out of that experience. So it's important for us to know that if you know you're gonna have sex on the regular, then you need to have a family planning option.
Yeah.
That is on the regular.
Yeah.
And reserve the emergency pill for emergencies only. But if you're taking the emergency pill every weekend, chick, you need a better family planning option. You need something else.
You talked of genetics.
Yes.
So someone also asked, is cancer genetic? Is it something that you can carry on to your family after you?
Okay, when you say you can carry on, sort of makes it the person who had cancer first feel guilty. So how I would put it is cancer genetic. There's a 10 to 15% chance if a nuclear family member or a family member has had cancer, then 10 to 15% chance that the offspring might have cancer, the sisters might have cancer, the brother might have cancer. So, and there are certain cancers that are related to each other. For example, if my mother had ovarian cancer, then I know, or uterine cancer, then I have a chance or a risk, especially if there was the BRCA gene involved, BRCA1, BRCA2, then there's risk of breast cancer and other cancers that are associated with the BRCA gene. So it's important to always know the family history and to know what has been common in my family. There are people who the whole family wears specs, where I come from such a family, so we all wear specs. So my dad wears specs, my mom wears, and this is where I am. So there are certain things that make you at a higher propensity that can be genetically passed. So the same with cancer. Not all cancers are genetically passed. There are some that, like for example, cancer of the cervix, that is really HPV mediated, human papilloma virus. So we can't say this is a family of people with human papilloma virus. I
like the fact that you highlighted that it's not something that the family member is responsible for. It is a circumstance that they just need to keep noting, even with the people around them.
Yes.
This one is always a touchy issue, and many people have mentioned it, and they're just like, someone needs to tell us the truth of what is actually happening here. That the treatment for cancer is there, but the bigwigs don't want it made readily available because they want to keep profiting from patients. How true is that?
That is part of the conspiracy theory around cancer. And I think conspiracies move like wildfire, and it's very nice to hear about conspiracy stories. However, when you're in the oncology space, you realize research is being done day in, day out. I think oncology is one of the fields where we have so many conferences. And in those conferences, new advancements in new medications are being talked about. What has been shown to increase overall survival, how long a patient lives, how long can you take this drug before you get symptoms coming back. And there is always education. Actually, part of our guidelines, you can read them tonight, and by tomorrow something has changed on the guidelines. That's just to show there is always research to see how can we make things better.
You've talked of the recurrence, and I'm thinking this is also a question that rings in my mind sometimes. Is there something in particular that causes a recurrence of cancer?
So nothing as a person. Okay, so let's put it this way. There's what I can do to reduce chances of recurrence. So one, if I am on the hormonal tablet and I'm supposed to take it for 10 years, please take it for 10 years. Do not skip a day, do not stop, do not get tired. When you're tired, please go for counseling. Let's remind you why you need to be on the tablet. Our lifestyle thereafter, it's important to do what is eat healthy, balanced diet, exercise, avoid alcohol intake, cigarette smoking. So there's what I can do. Then there is what is beyond my control if I have had cancer. Remember, it's one cell that stopped functioning well. That brought cancer. So what caused it? For example, if it's genetic, it means all my cells in my body, especially those in the breast, have that chance of becoming cancerous. So all it takes is another one cell to go crazy, and that's why it's important to go for surveillance. You'd find even after you're done with your treatment, would tell you, come after 3 months. Let's check how things are doing. Come after another 3 months, or come after a month. For the first 2 years, the follow-up is closer. After that, we can space it a little more and say come after 6 months. After that, we can space it. Sometimes we do follow-up for very long, even years after treatment, just to be sure you'll not have a recurrence. It's important to follow that, not to get tired, not to stop going for your clinic, and that can really go a long way in assisting to catch the recurrences early.
Thank you so much, Dr. for giving us this information. Someone mentioned something interesting, that she said that 50% of breast cancer patients who've been diagnosed have found that stress is was the cause of their breast cancer. So I don't know how true that is. Ebu, tell us, is this myth or fact?
Well, let's start by saying myth, because saying 50% of breast cancer is caused by stress alone is out of the charts. Even genetics that have been proven by a lot of research only account for about 10 to 15%. So giving stress a 50% is actually a total myth.
So cancer is not your fault, as Dr. has mentioned, but we are here to ensure that even as we are spreading awareness in this Breast Cancer Awareness Month, that the battle against breast cancer is actually won. We hope that these myths and misconceptions that we have demystified are going to help you in this battle. Ensure that you continue to keep safe, and we hope to demystify more things for you here on Citizen Digital. If you have any questions or topics that you feel that we should address, please feel free to reach out in the comments down below. I have been your host, Lynn Dinga.